So welcome to Watch Chew with me, Tim Crisp. And what we're going to do in this particular instalment is to identify what you need to do when you're first assigned a client. And I'm going to separate this particular aspect of training into three parts. Okay, so in this, the first part, I'm going to be looking at how to find the client. We're also going to be looking at how to identify the funding stream, and we're also going to be looking at how to find the assessment notes. In the second part, we'll look at the diary and how to enter your client sessions in there. And then in the third part, we will look at the clinical contacts, about how to fill those in and register the attendance of the clients, as well as how to enter your notes in reflection of the session. Okay, so in this, the first part, we're going to look at how to find the client, how to identify the funding stream, and then how to locate the assessment notes. As we can see here, we have an example boarding card in front of us. And this is, of course, an example, and the majority of the information here has been fabricated for the purpose of this exercise. So, first of all, how to find your clients? Well, there are two ways to do this. First of all, we can enter in that Find Patients field there, start writing out the name of the client. It's usually only 3 or 4 letters that you need to type in before the client's name will appear. Or we can enter in the IAPTUS reference number. Here we can see 2993 in that field, and the client will also appear. Now, the other way is if we come across to the left-hand screen, side of the screen a little bit more, we can see here the My Patient Episodes pull-down menu. Now, every client that's been assigned to you will appear in this pull-down menu. So you can simply just click on the name of the client and they will appear on the screen, okay, in form of their boarding card. So what we also need to do next is to be able to identify the funding stream for the client. And this is important, of course, perhaps for your timesheets, or certainly if you are a sessional counsellor and you need to identify which funding stream a client is from when you are including the sessions on your invoice. Okay, now that information is down here on the bottom right of the boarding card under the referral team. So we can see here that this particular client is given as belonging to the TBC 18s to 25s source of funding. Okay. Now, the other thing that we mentioned that we would look into is how to locate the assessment notes. Now, if we scroll down to just below the boarding card, we can see this series of tabs stretching from left to right across the screen. If I start to read them out, we've got patient registration, episode summary, and referral data going across in further tabs as well. And we need to just focus on the one in the middle that says assessment. So we'll click on that. And if we scroll down to just below the boarding card again, we'll see that the assessment notes have appeared. Okay. Now, what I've done here as well is included a few notes so you can see how the assessment notes are structured. Okay. So let's first of all start with talking about the problem summary. Now, the problem summary is where the main narrative about the client and their support needs will be given, and this will be in quite some detail. And what it should ideally be based upon is the information that we've received in the referral form. Okay, so here in the referral form, we'll have been advised that the client has been feeling depressed for ages, bullied at school and lots of exam stress. I'm not sure I can cope anymore. I'm self-harming and have dark thoughts about not wanting to be here anymore. So the assessment ideally looks to expand upon that, use that as the basis for the assessment, as to see as well, of course, what else might emerge in due course. Okay. Now, even though it's not been given within the referral form as to any support needs that might be there, it's always good for us to understand a little bit about the situation at home for the client. And by that, of course, we mean about the state of the relationship between parents, that kind of thing. In my experience at the Watt Centre, about 75 to 80% of the young people that we see come from a home where their parents have separated. And therefore, it's important just to get this kind of context as well, because while the client may not be realising that it's having an effect on them, but of course, it may be. So we just get that initial background. And then if there is a separation of any kind, then of course we start to look and get a bit more information about that. So for example, how long it's been that the mum and dad have been separated, if there are any memories that the young person has of that time, if there are subsequently any stepdads or stepmums, their kinds of relationships as well, could all be potential important information and perhaps raise a safeguarding need. Okay. And then, of course, we look at the referral reason in more detail. So we were talking there about depression, anxiety, exam stress. So we're just finding out a bit more information about that here. Ideally, the amount of time that the young person has been experiencing those kinds of difficulties for, if they're able to identify why they feel it may have started. Of course, it may be that the young person doesn't know this just as yet. This is, of course, part of why we're here, to help get that clarification. But ideally, if the client knows that kind of information, then we'll include that here. It's also important for us to look at the main risk factors to make sure that the client is as safeguarded as they need to be. Okay. Now, in terms of these risk factors, we call those the big 7. And we need to, of course, to check whether any of those are affecting the young person and to ascertain the level of threat that they are facing just at the moment. Now, the big 7 in that regard are if the client is experiencing suicidal thoughts, if they've attempted suicide within the last 12 months, if they have a tendency to self-harm, if there has been a bereavement within the family or perhaps of a close friend, if there is absence from school, if there is an eating disorder, or if there is a case of suspected psychosis. Okay, so with each of those safeguarding issues, we need to make sure that we know exactly where we are with the clients with regards to each of those, if any of those are relevant, to make sure that we're able to provide them with the support that they absolutely deserve and should be getting. Okay, so we can see here that in the initial referral reason, we were advised about self-harm. So here we can see that in the problem summary, we have checked about how often the young person tends to self-harm. And also they mentioned about dark thoughts. So here we can see that we've checked as to whether they're suicidal, okay, how often they experience those, and also importantly, identifying the risk of attempting suicide. Okay, and here we can see that that has been identified as being moderate. Okay, and of course, these are things that will be good to check in with the clients about during the counselling. Okay. Now, in terms of the patient expectation, if we scroll down a bit there, so these are essentially just the bullet points of the problem summary above. these ideally are there to help you quickly check as to what the main issues for the clients are, if you need to do so, if that is of help there for you. If we scroll down here a little bit more to the risk rating, well, we can see here that we have high, medium and low risk. When a client is assigned to you, they will have already been classified as high, medium or low. Now, how this is determined, we just mentioned a few moments ago about those big 7, we call them, those safeguarding areas to be aware of. Just to run through them again for us here, we've got if the client is experiencing suicidal thoughts, if there's been a suicide attempt within the last 12 months, if there are tendencies to self-harm, if there's been a bereavement of a member of the family or a close friend, if there's absence from school, an eating disorder, or a case of suspected psychosis. Now, in terms of the risk rating, we need to identify, first of all, if any of those particular safeguarding issues are present. Now, if there is a high threat to the client's physical or mental well-being, then we obviously then need to classify that risk as high. If there isn't such a high threat, okay, then the risk will have been classified as medium. If the big 7 aren't present at all, then the client will be classified as being at low risk. Okay. So when we scroll down here to look at the risk summary, we're again thinking about those main areas of safeguarding concern. And if there are any present, then we will just put them briefly in there. So you can see here we put self-harm and suicidal thoughts in brackets, moderate risk. Okay. So let's scroll down there to the management plan. What we put in here is, well, during the assessment, we'll have done a couple of questionnaires with the clients. There's the STAR and the CORE. This information is contained within this particular section. If it's not been possible for the assessor to do either or both, then it will be necessary for you to do those in the first session, and for you then to enter the STAR, of course, into the relevant web page. And of course, these are important, these 2 forms of survey, because, well, not just for reporting, but also for helping yourself and the client determine whether further support would be helpful for them. Okay, so this is the end of this part of this training video of what to do when you are first assigned a client. And as we can see, what we've done in this video is realised how to find the client, to identify their funding stream, and how to locate the assessment notes.